I just have a question. I have two questions. I just wonder. I just got diagnosed with CAD, and every day I'm a little scared. I just want to know what tests should be done. I got CAD in the neck arteries in
Yep,
one of them.
is
Uh-huh.
it's your carotids, right? Or is it
Yes,
your vertebral? It's your carotids.
I they
Okay.
didn't even tell me a specific name yet. I think it's carotid. No.
Mm.
So it's in one, the left. I just wonder what kind of exams, because I was reading a little more about it, because I just kind of find out about pieces breaking off. Like, what kind of exams they should do on me to avoid any kind of stroke or heart attack? Like,
All right. So
besides,
so you had the
besides,
carotid duplex ultrasound done already?
I already had that done. And
Okay.
yes, that's
So what was the blockage? What percentage they tell you?
they say it's from 59 to, I think it's 60 to
Fif-
79.
50, 50 to 69. That's typically what it is.
Yeah,
Okay,
hers
so
says is it 50 to 70? I
79.
think he said 79. Yeah.
79. But then
69. 50 to
the
69.
Is
the
it?
six so the CT scan says 70.
Okay. So you have moderate to severe carotid artery stenosis. So one thing is that you need to be on aspirin for 100%, right?
Yes, I
And
already
then
am.
yeah, you need to make sure that your blood pressure is always well controlled. So how
Hmm.
old are you?
I'm 50.
50. So at least less than 130 over 80, right? Then if you're diabetic, you got to control your diabetes.
No
Obviously, you
diet.
need to be on good. So you need to be on moderate to high intensity statin therapy. So your LDL, which is a bad cholesterol, needs to be less than 70, or I mean, I even push it to less than 50. Okay.
It's 43.
Awesome. Wonderful. So your good cholesterol should be more than 45,
It's
which I
55.
think, oh, beautiful. So, all right. So you have all the good stuff going on for you. Now the
Mm-hmm.
question is, when do we intervene? So if you have any history of, mini strokes or strokes, then you have indication to fix the carotid artery right now. But what you need is you need to have annual carotid Doppler
Yeah,
or a CT
they're doing
scan.
that.
Yeah. And then once it gets to about 80%, even if you don't have any symptoms of like, TIAs, etc., I think you still, these days, it's like class one indication to even fix asymptomatic carotid artery stenosis, which is, 70, 80%. But I would not rush for intervention right now. Just focus on primary prevention and annual follow-up.
The only thing I kind of get
So
is like a little lightheadedness and headaches a little bit.
typically the carotid artery occlusion will not cause lightheadedness. So
No?
lightheadedness will happen if you have vertebral artery insufficiency.
A what?
So vertebral arteries, those are the two blood vessels which are running in the neck spine area and going to the back of the brain. That is what is controlling the balance center of the body. So if you have carotid artery stenosis and it is affecting your sort of middle artery, middle or anterior cerebral circulation, you could potentially have like little dizziness here and there. What I would recommend is you should get a CT scan of the head um, to make sure that you don't have any um, small, like sort of mini strokes, things like that. So that should give us a good baseline. And then the other thing is, headaches again is multifactorial.
Mm-hmm.
So you have to figure out whether the headache is like a tension headache, is it a more vascular headache? Do you have headaches when your blood pressure is high? Do you have sleep apnea? And
I
you
do have
wake
sleep
up.
apnea.
Okay, so then you gotta make sure that you're using your CPAP because when
Ah,
you are, huh?
okay. Yes, he started this, but he hasn't given it to me yet.
Okay, so I'm glad they're working you up. So sleep apnea and headaches and high blood pressure, atrial fibrillation, these are all related. So I think you're on the right track. You're getting everything taken care of. Follow up with the imaging in another year. But if you've not had a CT of your head, not an unreasonable thing to ask for that.
They did. It came out good. The CT scan came out good. The head.
Oh,
Oh, good.
beautiful.
So thank you so much. That was good
You're
information because I've
welcome.
been scared. I've been so scared every day. I don't know. I just scared about the loose plaque or I don't even know. It's just
No. So you are on right track. Your numbers are good.
okay.
Just keep on your medications and have a follow up.
Thank you so much.
You're
Thank
welcome.
you, Rose.